Welcome to our guide on cleaning your SpiroConnect device. This guide covers how to clean and look after your SpiroConnect device. There are three main parts to the SpiroConnect. First are the mouthpieces. These are single-use and disposable, so do not need to be cleaned. Next we have the main unit and the turbine. We need to separate the two parts for cleaning. Turn the green dome gently 90 degrees anti-clockwise to release the turbine. It will then be possible to lift the dome and turbine tube out of the device. The SpiroConnect itself, the main unit, is the white plastic handheld part. This can be cleaned with clinical detergent wipes. Ensure they are no more than slightly damp. If moisture gets inside the unit, it can cause damage. Liquid ingress can be a costly problem as it often isn't repairable. Lastly, we have the turbine itself. This is always removed for cleaning. There are two ways to clean the turbine section. Routine cleaning. Using clean, warm soapy water, gently and thoroughly submerge the removed turbine and then rinse well with clean drinking water. Leave this to air dry before using with patients. Sterilization. The device can also be sterilized using a PeriSafe solution. Please follow the manufacturer's guidance on the PeriSafe container to ensure the correct solution is mixed. Currently, this is 1 sachet of PeriSafe mixed with 1 liter of lukewarm water. Stir to dissolve this and wait for the color of the solution to change. The turbine is then submerged in the solution for 10 minutes. Do not exceed this amount of time as it can start to damage the turbine. Remove the turbine at the 10-minute point. Immediately rinse with clean drinking water. Leave the turbine to air dry. It is important to ensure the outside of the turbine is dried before reinserting into the SpiroConnect. If there is still moisture inside the turbine when the outside has dried, this is less of an issue. Gently shake the turbine to help any trapped moisture to escape. Calibration verification will also help remove excess moisture from inside the turbine tube. If the device is going into storage, please ensure this is fully dry before putting it away to avoid problems later. To insert the turbine, simply reverse the earlier process, slide the mouthpiece in at the 90-degree angle and turn the device until it clicks back into place. When to use sterilization versus regular cleaning is up to your own local policy and procedures. With careful cleaning and regular NuMed servicing, your device will be kept in top shape. This ensures the best results for you and your patients.